All right, well, welcome back to my channel. So if you've had a hysterectomy and you just gotten home, what things do you look out for? What things do I want patients to know? If that sounds good to you, keep watching. Well, welcome back to my YouTube channel. My name is duPont. I'm a board-certified gynecologic oncologist, and I'm passionate about educating women on how to improve their lives, and I believe this starts with great health. If you're new here and you haven't subscribed, please click the link below and continue watching. Alrighty, so total abdominal hysterectomy is one of the most common surgeries that I do, and it's one of the most common surgeries done in women. And what is it? So total abdominal hysterectomy, and I to explain this to patients, is removing the uterus and cervix. So total just means complete. There used to be an old term like subtotal or partial. It's not really a term that we use anymore, but total abdominal hysterectomy means I'm removing the uterus and cervix. And the reasons we do that would be, big fibroid tumors or big pelvic masses or cancers of the uterus or tumors of the ovary. Now, bilateral salpingoophorectomy just means, pingo means tube and oophorectomy means ovaries. So it's removing both tubes and ovaries. So sometimes when we're doing a hysterectomy, it depends on the patient's age and the reason for the surgery, we'll remove everything. So we'll remove the tubes and ovaries and the uterus. Sometimes, depending on the patient's age, we may just leave. We actually may take the tubes to reduce the risk of ovarian cancer, leave the ovaries because they do provide hormones, or take everything. And so it just varies on, why your doctor has decided to do your hysterectomy. Now, a common way we do hysterectomy nowadays is laparoscopic or robotic. And I'm not going to talk about that today. I'll talk about that in a different video. Today, we're going to talk about the total abdominal hysterectomy. And that's when you have either a big midline incision that's up and down or a fan and still incision, what looks like a C-section scar, which is usually transverse. Those are the most common ways that we open the skin to be able to get the uterus, tubes, and ovaries out. Other reasons that we do total abdominal hysterectomy besides, ovarian cancer surgery, especially for advanced ovarian cancer, uterine cancer that's maybe metastasized already and there's big tumors or big masses. Sometimes patients with really bad adhesive disease or endometriosis, sometimes we have to do a total abdominal hysterectomy. A lot of times there's so much scar tissue that we can't always do the hysterectomy through small incisions. Now, most patients who have a total abdominal hysterectomy will be in the hospital for 3 to 4 days. A lot of times the nurse will get you up and out of bed that very next day. They'll want you walking. A lot of us now will do what's called ERAS, or early recovery after surgery, where we want you up and walking. We'll feed you right away, as opposed to many years ago where we used to wait until you had return of bowel function, which usually meant you were passing gas. But nowadays we feed you right away because we think that does help with your recovery. And a lot of times once you get home, there's some things that I want my patients to know and I want you to be able to be aware of. So the big thing that I'm looking for after surgery is to make sure there's no complications. So things like fever. If you have a high fever that's not going away, let your healthcare provider know. Infections are one of the common complications after surgery, such as, wound infection, bladder infection, vaginal cuff infection, pneumonias can happen. Not as common, but they do happen. Other things we worry about are things like bleeding. So your incision may separate, you may have an opening in the incision. Those are things that your doctor wants to know about. Other things are things like shortness of breath or swelling in your legs. So we worry about blood clot either in your lung or your legs. So those are symptoms that we want you to be aware of. You have swelling in the leg, and usually it's one leg, it's painful, or may just one be swollen, not the other. Those are things that, are very concerning. You should let your healthcare provider know. Other complications that can happen after a hysterectomy is a heart attack. And so a lot of times, I'm very stringent in getting cardiac clearance on patients, especially my diabetics, my patients with high blood pressure, especially those who are uncontrolled. A lot of my older patients, I'll get cardiac clearance because what we want to do is reduce your risk for complications after surgery. Now, some of the things that I talk to my patients about before surgery to kind of ease their recovery is I like my patients to take a general multivitamin. Some of my hospitals and nurses will say, stop all your vitamins, but I tell them most vitamins, as long as they're general over-the-counter vitamins, are fine. I tell my patients to take a probiotic before surgery and after. I take one every day, but I think it's really important for the immune health. I'll tell patients to 2 days before surgery to take Tylenol around the clock. So I'll have my patients take a gram of Tylenol every 8 hours for 2 days before surgery to kind of help with pain and also to reduce the risk of narcotic use after surgery. And then I also tell patients to use a stool softener. I find a lot of women have troubles with their bowels and complain of constipation. So I'll tell them start taking the stool softener early, because the narcotic pain medicine you're given, the anesthetics you're given, and then some of the nausea medicines, some of the side effects is constipation. So I tell patients, start taking the stool softener before surgery. And then when you get home, continue to take either a stool softener or actually prune juice is very helpful. When I was in training, a lot of the older nurses had just great tips just from years of experience. A lot of times they would warm prune juice in the microwave for patients, or you can do it on a stovetop, and it really helps move your bowels. Like, I don't like prune juice. But when I had surgery, I took it and it was like, oh my gosh, this really works. So it's kind of a trick that you can use without using medicines, is prune juice, or increasing the fiber in your diet, or even eating prunes. If you like prunes, then just eat the prunes. They're very good in fiber and they will help keep your bowels soft. Another thing we want patients to know, especially I want my patients to know, is I want them up and walking. I don't want them lying in bed all day. I don't want them sitting, on the recliner all day. So the more active you are, the quicker you're going to get better. The more you're standing up and you're walking, you'll take deeper breaths, reduce the risk for pneumonia. And then, I tell patients, walk to the mailbox and back. And as you get stronger, you'll be able to walk a little bit more. Tell patients it's okay to go up and down stairs. You're not going to run up the stairs, but you can go up and down stairs slowly. Other tips that I give my patients is to get an abdominal binder. Typically, when you're in the hospital, they'll put one on. You'll have one usually when you wake up from surgery, and that really helps with the pain. Like if you have to cough or sneeze, or if someone makes you laugh, you'll notice, oh my gosh, that hurts so much. Abdominal binders, there's a lot of great ones. I usually tell my patients just go to Amazon. Usually the abdominal binders for hernia surgery or the pregnancy ones. There's some that I've seen on Amazon that are for C-sections. Those are very good, just because you really want something just to hold your tummy in. I'll tell patients if you have a girdle, wear that, or if you have Spanx, wear those. You just want something tight when you're walking that just kind of holds your tummy in, because you realize when you're walking or you're sneezing or you're coughing, every stitch you'll feel. It'll be very painful. So, have an abdominal binder. And then if I have someone go home with their binder, typically the ones they give you in the hospital, don't put them in the dryer. You can wash them, but air dry them or hang them if you're going to wear them multiple times. And then I tell patients don't sleep with the binder, because I've had people over the years tell me it hurts their back. So I say the binder is great for walking or if you're moving around, but don't sleep with it. And then in terms of driving, I tell patients, I prefer them to not drive for 2 weeks after an abdominal hysterectomy. Now, I do have patients that do drive before then, but I tell them it's more really of a safety issue. We don't want you causing an accident. We want to make sure you're safe for the community. So if you don't feel safe or you're not sure, then don't drive, just wait. I've had patients over the years that'll either have family members bring them food, or they'll cook food ahead and just freeze it so that after surgery, they can just kind of heat up a meal in the oven or microwave so that they don't have to cook. Those are kind of the biggest tips that I tell patients. The main thing is just listen to your body. If you're tired, it's okay to take a nap. If you're hurting, try to rest. Try to use non-narcotic medicines. You'll probably go home with the narcotic pain medicine, but try to only use it, at night, or if your pain is severe. Certainly, if you need it, definitely take it. But I've had patients over the years that have alternated Tylenol and Motrin, and they do really good. I'll send patients home with a few narcotic pain medicines, but we're really trying to reduce the risk of narcotic abuse. So definitely Tylenol, Motrin alternating is very safe. Of course, if you're on any blood thinners, you want to avoid the Motrin or the Aleve, because that can make your bleeding worse. But definitely try the non-narcotics. Heating pad helps a lot. So there are a lot of different ways that you can control pain. And then, if that's an issue for you, or if you've had problems with narcotic pain abuse in the past, let your doctor know. There's lots of, new things that we can do now to reduce the risk of pain. So the main things you want to look for are, signs of infection, signs of heart attack, signs of blood clots. Those are kind of the big things that we look out for. But in terms of recovery, be kind to yourself, and just, everyone recovers differently. I have some patients that recover quicker than others, and some people take twice as long. It really depends on so many factors. I find patients that have really good family support usually recover quickly, because it's just that sense of community. A lot of times patients will just heal quicker. But the main thing is to not push yourself. And if you need rest, to rest. But to definitely make sure you're up and moving, because walking is very good in recovery and reduces your risk of complications. Well, I hope this was helpful for you. If you have any questions, or if there's something that you found that was really helpful after, your open abdominal hysterectomy that you found helpful and you want to share with others, please put them in the comments below. If you have any questions, just let me know. Otherwise, I hope this video helped you to move a few steps forward to reclaiming your life. Thank you for watching, and I'll see you next time. Bye-bye.